Good morning, everyone. Thank you for joining us today for uh, currently the fourth event on the third event on the series of care roundtables. We are discussing today about various models and applications of culture on prescription. We are very happy that you decided to join us this morning. I will start with the first question to you. If you agree to us being recording this meeting, you may already have been receiving the notification from your Zoom. In the case you prefer not to be shown on the recording, just choose to close your camera when you speak. But otherwise, we would very much appreciate if you are keeping your camera open. It creates more of a sense of communion. I am Rarita Zbranca. I am the program director of the Cluj Cultural Center in Romania and also the leading organization of the CARE project. And the CARE project, which stands for Culture and Mental Health, is the framework in which today's roundtable is being organized. I'm going to give you a very small introduction into this project, and later on, our colleague Kornelia Kiss from Culture Action Europe, who are the organizers of today's event, will moderate the meeting and will introduce our distinguished speakers. Just to let you know also on how our meeting will take place, after this brief introduction, you will hear some presentations from our speakers that will present general considerations on arts on prescriptions, what makes these types of programs important and timely in today's society, how they came to be implemented. We also have some research insight on what we learned from the experience of various programs that have been evaluated, and how these type of programs create an impact and how they can be improved. But we will also learn about two examples, two exemplary ways of creating arts on prescriptions, and that will come later on during the session. We also aim to have short breakout rooms where we would like that each of you would be able to share a bit of your experience of your own opinions regarding the topic that we are discussing with, and then we will have a bit of wrap up together. Now, a few words about the CARE project. It is an initiative that is supported by the European Union through Creative Europe program. It is implemented by 7 organizations across Europe, which are mainly networks or umbrella organizations that are based in various countries: Romania, Belgium, Latvia, Slovenia, Austria. So very different places, but with a very well connected European network of professionals. I would like also to ask you, if possible, while you're not speaking, to mute your microphone, so we ensure the best quality of sound for everyone. It's a 3-year project that is already in its towards the end of its first year of implementation. What this project is trying to do is taking stock of the existing realities of the culture and health movement. We understand currently that there are a lot of initiatives happening kind of scattered throughout Europe in different communities, wearing different types of names. Maybe that's less relevant in terms of the interaction between arts, health, culture, well-being. Our project is trying to see how could we make a next step from fragmented and small scale projects to systemic impact, how models that have already proven their efficiency at the level of piloting can be now embedded in policies, in mechanisms, in the long-term strategies of institutions, both in health and culture sectors. So the history of this project is in the Culture for Health project, which was um, preparatory action of the European Parliament and European Commission. Out of this project, most importantly, a report known as the Culture for Health report, which was published in 2022, has been released. The report is also summarizing existing evidence on the impact of cultural participation for health and well-being in general, but also a series of recommendations for policymakers at local, national, and EU level. And based on this reality, we have currently two sister projects being implemented. One of them is the Culture and Health Platform, which is um, an initiative that is trying to support over several years through grants over 200 emerging artists in the area of arts and health to professionalize their activities and to reach out stronger partnership with health initiatives. And CARE is the current project that is looking on how scaling of such initiatives can take place. We would like to also draw your attention on a number of useful resources that have been created on the Culture for Health website. You can find them there, from the report to a mapping of over 800 initiatives in culture and health, and also a toolkit for practitioners with case studies. It could be useful to have a look at them. I think the links are already shared in the chat. And very briefly about the thematic focus of the CARE project, we have three core themes that we are exploring. One of them is youth mental culture and youth mental health. Another one is culture and work-related well-being. And what we are discussing today is models of culture on prescription. In parallel to that, we are, in a way, transversely, we are exploring also how festivals are engaging with arts for the well-being of their communities. And we are also looking at an intimately related topic: how do we take care of the artists and cultural workers in initiatives that are related to culture and health, but also broadly in the cultural sphere. And that being said, I'm passing the floor to Kornelia Kiss, who is going to moderate today's event, but not before sharing with you. Maybe it's best to have a screenshot if this is something of interest for you, a mapping of upcoming events related to culture and health, where you are more than um, warmly invited to join. So, Cornelia, the floor is yours.
Muted. So good morning. I'm very happy that you are there. Thanks for coming. My name is Kornelia Kiss from Culture Action Europe. And I'm going to help moderating this session. Without further ado, I think it's very good if we directly jump into what exactly is arts on prescription. So we have reached out to Hamaad Khan from the National Academy of Social Prescribing in London, UK. And he will just give us an overview of what is arts on prescription and some UK experiences they have. Thank you so much. Hamaad, the floor is yours.
Thank you so much. And hopefully everyone can see my screen and hear me quite well. It's a pleasure to speak to everyone here today. And thank you to CARE and Culture Action Europe for convening this brilliant platform. I'm going to give a very cursory background on arts and prescription because I know a few of the other speakers later are going to give very specific developments across their context. For a background, my name is Hamaad Khan. I am the International Associate for Development at the National Academy for Social here in London. And I'm going to talk through a bit about social prescribing in the context of arts and prescription, and then looking at very specific policy and practice developments in London that have been quite influential and instrumental, and hopefully it can culture some conversations on how we can have cross-cutting lessons, and hopefully we can learn from you as well. Just for the audience, I'm sure quite a lot of you will know what social prescribing is, and it's the mechanism by which arts and prescription is formally delivered, particularly in the UK. And I've just put a QR code there if you'd like to see. There is now an internationally developed definition for social prescribing. The idea that a person has a social unmet need, and in the UK and in England in particular, they can go to the health services to get their unmet need. And in the context of arts and prescription, it's where a link worker, a health practitioner, or anyone who is screening the patient is able to identify a creative-based intervention and prescribe that to that patient for well-being outcomes. And just to summarize the importance of social prescribing and in the context of arts and prescription, the single one-liner I'd like to give to everyone is that it's about building system resilience in modern healthcare, but most importantly, with community-centered care. And all of that is grounded in well-being. So when we talk about a reduction in health visitations, a reduction in A&E visits, a reduction in primary care visits, because we're giving arts and prescription, that's useful, that's value. When we talk about a return on investment, that's brilliant. But I think what all of us agree on far more is the value that arts and prescription gives, and in our case, through social prescribing, is very much so about grounding well-being, long-term resilience and well-being for each individual. So just a quick background on social prescribing in London and the global work that the National Academy does for social prescribing. And it might be of use for any practitioners and for any partners to think about how they could perhaps join. But we're very proud at NAS to convene the largest international social prescribing network of policymakers, practitioners, and we have interest, and a few of our speakers here are part of the International Social Prescribing Collaborative, and we're working towards perhaps developing a working group on arts and prescription as well. We work at the highest government level with ministries of health, and we also work with regional departments and NGOs and municipalities looking at how they can implant arts and prescription or general social prescribing across their settings. We're really proud to have over 32 member states. That's just a cursory group of the countries that we have, and a QR code if you'd like to join our LinkedIn group, and we have a formal newsletter as well. But that's the International Social Prescribing Network. And before we go into the very specifics on arts and prescription and creative health, the National Academy for Social Prescribing worked with the WHO to look at social prescribing around the world. And there are quite a few examples of arts and prescription and creative health on prescription on the global report on social prescribing. So if you'd like to learn more about that, just look up social prescribing around the world. There's just a quick cursory image of quite a few of the countries that we have, but my email if you'd like to learn more as well. So arts and prescription, creative health, what is the policy, practice, and pilots? So this is a very, very simple timeline of how arts and prescription has developed across England. And we'll start with Bromley by Bow in the 1980s and early 1990s, where we started to have an integration of arts and well-being in a community setting. And Bromley by Bow, if you visit London, it's recognized as a foundational social prescribing site. It's really brilliant because if you go there, you've got a GP clinic, a primary care clinic, but then you also have a pottery class that members of the community are coming into. What's really important, they aren't patients, they are members of the community. And so there's this co-location and the increase in access of care arts and prescription. Around 2004 to 2007, there was a brilliant pilot called Artlift by Dr. Simon Ofer, who was a GP, a primary care physician, and he welcomed artist residencies within the primary care clinic for patients, particularly with anxiety and depression, and it's now expanded and scaled at that time to 15 NHS community sites. And what was really valuable was it showed the development of scaling up arts and prescription. It doesn't necessarily need to be a single workshop just within a community. And maybe for a topic of discussion later on, what you will find in the UK at least is a lot of arts and prescription is encouraged or established through or funded with the formal healthcare system. And we can talk about the value of that and also perhaps the need to move beyond that as well. But I've just added on here, the next thing that I think is really valuable for looking at the timeline for social prescribing is the NHS long-term plan. Now, this isn't really directly relevant to arts and prescription, but the NHS long-term plan was and is still the first national policy development that recognized personalized care and social prescribing, and it was really pivotal in inculcating social prescribing at a national level. And through that, arts and prescription was recognized. Through that, we had the infrastructure and mechanism for GPs to screen patients who may benefit from a creative health intervention. And just ending on the last point, since 2023, NASP, the National Academy for Social Prescribing, where I work and I'm representing, we've developed the largest national fund on music for prescription. And we've had over 200 grassroots music projects. And we've got a digital platform of directories of various different music-based interventions that people can visit. And I'll talk more about that. But just before I talk more about what NASP is doing, something else to highlight within the UK is the National Centre for Creative Health. That's the definition of creative health. And I think it's really important when we talk about different examples across different countries and settings that our vocabulary might be different, but this is very much arts and prescription. It's called creative health, but as it says, it's across the various different modes of art and implying this intervention across homes, communities, cultural institutions, and heritage sites, as well as healthcare settings to improve well-being for all. They've got a brilliant project called Mobilizing Community Assets, which was UK Research Institute alongside UCL, and it's looking at how they can reduce health inequalities through creative health interventions, which is really valuable because a lot of the literature out there at a global level, you would recognize there's concerns about culture-based prescriptions, art-based prescriptions that aren't accessible to those that perhaps most need it. And the other interesting thing is the all-party parliamentary group and for creative health, the APPG for creative health. I'm conscious of time, but I'll just say that the APPG for creative health is very simply members across different parties who recognize creative health as a pivotal issue, and they created a group for creative health, and they've developed a report in 2024, and I do urge you guys to read it. Apologies, I don't have the QR code, but I'll send the link in the chat. But you can also just look up Creative Health Review, and it shows what we need to do from a policy level to include creative health, both in health and social care sectors. So as I mentioned, the National Academy for Social Prescribing is developing two new national projects that sit under arts and prescription. The first is Power of Music. Now, this is a UK-wide initiative, and we've partnered with the UK Music, Music for Dementia, and Manchester Camerata. And the aim is to integrate music into health and social care, particularly for people living with dementia and their carers, which is really valuable. And in 2023, with the Utley Foundation, the National Academy for Social Prescribing developed a £1 million seed funding, which we have used to support over 200 organizations by giving them micro grants. And we've measured an impact of 12,000 beneficiaries as well. Essentially, it's about embedding music-based activities through social prescribing, through the link worker mechanism that we have. And we're hoping to evaluate the impact, again, with not just a reduction in health services, not just a reduction in ill health, but also looking at how we can improve equitable access, because that's really necessary in the arts. And finally, Music Can is another huge development that the National Academy for Social Prescribing is doing. And it's an online resource that is to look at what are the music-based community interventions that are out in your local communities so that you can connect social prescribing link workers with carers and their individuals. And so it's a very public directory that anyone can use to search. And you have, for example, music groups, choirs, therapeutic sessions, and they're tailored very specifically, again, to dementia care needs, but also beyond as well. And hopefully, what we're hoping it demonstrates that a national directory that is able to spotlight arts-based prescriptions, and in this case, music-based prescriptions, is improving access and providing the necessary guidance that is needed for those that most need it as well. So again, streamlining the service of arts-based prescription. So I didn't time myself, but hopefully that wasn't too long, and I apologize if it was. But thank you so much.
Thank you so much, Hamaad, for this wonderful presentation. I was wondering if somebody would have some questions for Hamaad. We have maybe 2 minutes for that. I see a clapping hand. Please, to ask questions, just raise your hand in Zoom. Magdalena, I see.
Just a very short question. If it is prescribed, it means it is paid for? Is it paid by the...
Yeah, so the funding mechanisms can be interesting. So the prescribed element of purely to get clinical champions on board so that the medical workforce can be comfortable in saying, yes, we also support creative health. The funding mechanism is you get for example, you can have charitable organizations, philanthropic funding that fund very specifically the intervention. So they could be community-based organizations, voluntary care sectors that are funding this, and they apply for grants in particular. There is an argument that that's not sustainable mechanisms of funding. And so what the National Academy for Social Prescribing is doing is calling for a matched fund program called the Shared Investment Fund. So it calls on philanthropic funding, voluntary care sectors, government funding to match £10 billion over the next 10 years to support community-based groups as well. But there's no paid model that's required on the patient or the person side.
Thank you.
Anybody else would have another question? I don't see, so I think we will go over to Anita Jensen, who is a culture and health strategist in the Skane region in Sweden, who's been researching arts and prescription mechanisms for a long time and is very knowledgeable of what works, what doesn't work, and we are very much looking forward to her presentation. Anita, the floor is yours.
Thank you. Wonderful, thank you. I'm trying to do some speed talking also, being aware of time. So I work as an assistant professor at Lund University, as well as an arts and health strategist at primary healthcare in Region Skåne, which is in Sweden. I'm going to talk about, I'm going to introduce some findings from various studies looking at the evidence and impact from arts and prescription programs. So we've conducted a systematic review where we included 25 studies from 5 different countries, from the UK, from the USA, from Australia, Denmark, and Sweden. And here we found that all studies showed a statistical increase in well-being scores with an overall significance in the meta-analysis that we did. We also saw some psychological benefits, such as boosting confidence, self-esteem, enjoyment, relief from worries. We also identified social benefits, strengthening connections, relationships, and social confidence, as well as progression opportunities for the participants. They saw some new paths opening for them, and positive. They experienced some positive life changes.
Sorry, Anita, I don't know if others have that too, but I didn't see your second slide. You're still at your first slide. Probably.
Oh.
Everyone else sees it? No. Can you move to the second slide of your presentation?
I think you have to click on the second slide.
I'm doing that. I see it myself. Okay, well, I'll try this mode instead. Did that work?
Yes.
Yes, it changed. Wonderful.
Okay, sorry. This is just what I said. So I'm not going to repeat it. So we also conducted some other studies. We have looked at some of the primary healthcare practitioners that has referred patients to these programs, and they reported that they saw a need for more holistic approaches to treat people with mental health problems. They saw their patients benefit in terms of motivation, routines, social interaction, and increased self-esteem. And they also saw arts and prescription having the potential to positively impact primary healthcare services and society at large. They also identified that time pressure and the dominance of the medical model as a barrier. In addition, we have also done a study on cultural institutions that has been part of arts and prescription programs, and they identified that they've had a positive collaboration with the healthcare sector, that they themselves developed some new professional skills, and that they were motivated to collaborate with different stakeholders in the future. We also did some critical perspectives on arts and prescription, looking at what works, what doesn't work, and we saw some considerations that needs to be looked at different stages of the model. How are referrals made? How are the groups managed? What are the opportunities for moving on? What care paths are there for participants? And also developing research-based guidelines. So we've also looked at, there's a study from Denmark looking at adults between 18 and 65 years old. And here we saw that, that arts and prescription can improve mental health well-being. It can create supportive spaces and be a catalyst for change. And programs may enhance social and work readiness. In another study, we looked at a hard-to-reach group of young adults between 18 to 30 who were outside the job market and education. And here we saw that being part of an AOP program strengthens mental health well-being and improved everyday life, supports education and work readiness, and promote positive identities and supported inclusion. So in another study, we looked at, from Sweden, we looked at 112 primary healthcare patients from different primary healthcare centers with mental health issues and social isolation. And here we saw the overall result as a catalyst that arts and prescription could be used as a catalyst for change. We saw a significantly increase in well-being and health, and more social contacts and increase in sense of community connectedness. We saw that structured activities were created routines for the participants, and we saw increased activation and self-efficacy. And we saw the focus shift from illness to well-being. So all in all, we have some recommendations for programs, and we have identified some barriers that have implications for and they are physical, to do with transport, language, mobility, and some participants are simply too ill to participate. In terms of psychological barriers, that could be anything from engagement, patients preferring medical solutions, or considering art as being elitist. Some social barriers has to do with group dynamics and stigma, and systemic lack of awareness amongst the health professional, as lack of support at the end of the programs, and sustainable funding. And we recommended for future research specific measurements, looking at specific measurements for anxiety, depression, and loneliness. Also investigating how arts programs are designed to match participants' needs and preferences, and also longitudinal research and research with comparison groups. So as a summary, arts and prescription has the potential to improve well-being and reduce social isolation through non-clinical pathways. we see potential multiple mechanisms in play, such as the social cure, gaining new social connections, community connectedness, participants' activation through routines and structures, and psychological aspects such as flow, relaxation, and autonomy, and also the ability to express yourself while sharing, reflecting, and having a voice. In addition, there's some critical problems with practice and delivery, including creating safe spaces for participants, sustainable delivery of activities, and continuing care pathways. So all in all, there's a potential for scaling up and applying across cities, regions, and different patient groups, bearing in mind that there are some cultural barriers to navigate and not one size fits all. So thank you very much for your attention, and I like to share that we are currently implementing arts and prescription across the whole region as a primary healthcare initiative. So all our primary healthcare patients will, in a couple of years, be able to access arts and prescriptions program as part of their primary healthcare.
Yes, thank you so much, Anita. It's really marvelous how arts and prescription has grown in the Skane region, and how advanced you are in having also an arts and health strategy in the region, which we hope will kind of also go over to other countries as well, because of course the development across Europe is very varied across countries. I just wonder if somebody would have, I see a lot of clapping hands. It's great. I just also wonder if somebody would have some questions for Anita. Please just unmute. Edith has a question.
Hello, Anita. You put in the slide regarding changing habits. You had a number there which I didn't mention, but I couldn't quite see it. It was, I think, 10 weeks of 2 hours. Do you have any benchmark? How long it takes? What it takes to change habits?
That's a very good question. The studies that what we're implementing is 10 weeks. We see that anything less than 10 weeks is quite difficult to work with, but there are programs that are only 6 weeks and 8 weeks also, but we have decided in primary healthcare that it takes 10 weeks, and also that's the same as receiving different other activities, such as we have physical exercise and prescription, we have mindfulness and prescription, we have cognitive behavioral therapy, which is also 10 weeks.
Okay, thank you.
Anna Formosa has the next question.
Hi, thank you for the presentation. I was just wondering if you could explain a bit more about how you take the study. Is it by questionnaires? How you measure the wellness that takes place?
Different studies. We've done some qualitatives and some quantitative studies, and the latest we've done, we measure baseline. So we measure people's well-being through different questionnaires, and then we measure at follow-up 10 to 12 weeks later. And then we have done some qualitative studies as well to match with the findings. So we've done mixed method studies.
Thank you very much.
I see one other hand raised, but I'm not sure if that's the case. Yes, Veronica, please go ahead.
This is really, really so interesting. And I wanted to ask a bit more about how you, like, what does the intervention actually look like? So what do patients do, and how you pair maybe different types of arts on prescription with different types of people, like they have interests, talents, I don't know. Is there some kind of pathway through which they go through? Yeah, can you tell us a little bit more about that?
Yeah, I'm sorry there isn't much time because I could spend hours talking about this, but I'll be very brief. We try to we say that we try to activate different senses. So in our program, we have different cultural activities. We work with different cultural institutions. They present different programs. So it's different art disciplines, but it's also something that is both receptive and also active. So sometimes it's listening to music and then discussing it afterwards. Sometimes it's creating a visual art piece and having a guided tour of the museum. Sometimes it's something very different where you are just doing ceramics. So we really try and activate different senses, and also using different art disciplines is very important, because all the group have different preferences. Some people really hate literature but are exposed to it anyway, and some people find joy in music. So we find that the variety of the program is really important.
So within the 10 weeks, sometimes, so you don't have one art form all the way through, but you really mix with everyone, also a little bit in an obligatory way, even if they don't like, let's say, literature.
Yes, it's good to be exposed to different things, and they're usually positive about it afterwards, because most people get curious about things also, and yeah, but not too many different things either, because it's quite a vulnerable group and exposure with too many things. So it's finding a good balance.
Excellent, thank you so much. It's actually interesting how, let's say, Hamaad was talking about only music, and then I'm not only music, of course. I'm sure they are doing various ways of arts and prescription, but Skane seems to be really like proactively mixing it. I think we have to go to our next speaker, who is also going to have a very good presentation on the project. It's a huge Interreg project, Arts and Prescription, which means that 3.5 million euros across 7 countries were testing a similar model that actually Anita has been explaining. And Stine was leading this consortium, so I'd like to give the floor to Stine Keiding, Program Director at Culture Region Finn.
Thank you, and I'm trying to see if I can share my window. Okay, so thank you very much for me participating here today in this very inspiring event. I'm very happy to be presenting how we work with arts and prescription in Funen, and as you said, Kornelia, this is also being part of the arts and prescription region. We have worked with arts and prescription since 2022. And have included people who have mild to moderate mental health issues such as stress, anxiety, depression, or loneliness. What we are trying to provide for them is what we call in Danish frirum, being translated into a safe space or a demand-free space where they for a while can maybe forget about their daily struggles and instead immerse themselves into arts and be part of a group. We are also working with programs that have very different arts categories. We agree that it's a good type of program that people are exposed to different arts categories. Usually it's between 3 to 5 in our program. We mostly have programs of 10 weeks, but we can also have them down to 6 weeks. And we include about 10 participants in a group where they meet for 2 to 3 times a week for 2 hours. We started up with arts and prescription in Funen with the project Fyns Kultur på Recept, which was funded by the Ministry of Culture and the 9 municipalities that are part of Kulturregion Fyn, or Culture Region Funen. We piloted 30 programs, and there was a regional coordinator hired with a healthcare background and previous experience in arts on prescription, and she supported the municipalities in setting up the programs, but also to make it possible to have knowledge sharing between the municipalities and between staff from culture and health sectors, as well as other sectors that were involved in arts and prescription. We also hired mentors with experience in art and health programs or projects to support facilitators who have not tried out arts and prescription before. Since 23, Kulturregion Fyn has been an associated partner in the Baltic Sea Region project, and Odense, which is one of the 9 municipalities in Funen, is the lead. In this project, 5 countries have tested 24 pilots and tried out a generic program that can be adapted to local and country-specific needs. And during this project that is coming to an end, we have also, the partnership of 13 partners have co-created an AOP guide to link workers, facilitators and decision makers. I will show you a link to that later on. And in 25 and 26, Kulturregion Fyn is working with a new project called Fyns Kulturrum, which is part of a initiative of handing out culture passes to young people. So what we have been granted money for is to do a combination of group-based and facilitated culture activities and internship and work trials for young people who are not in education or employment. The primary staff that we involve in our arts and prescription programs are, of course, the facilitators, who can be cultural workers at cultural institutions or independent artists. Their main responsibility is to prepare the venue and the materials before the participants arrive to an activity, to introduce the participants to the activity, and also to guide them through the activity so the participants feel comfortable. Then we have the link worker, who is running the day-to-day AOP program and must have skills in supporting people with mental health issues. They link the individuals to the activities. They are the contact persons for the participants by ensuring ongoing communication with them about time and where to meet. And then the primary role is to support the participants' well-being, and they do so especially by taking part in the program. As the participants are going to different venues, meeting different facilitators, we find it quite supportive that they have this one steady figure that is ongoing through the whole time. Some of the lessons that we have learned in the different arts and prescription programs that we have conducted is that it is very important to co-design AOP. AOP programs are cross-sectorial by nature and should adapt to different logics, objectives and needs. And also, when staff from different sectors co-design a program, they are more likely to understand each other's perspectives and to feel a shared ownership and responsibility, which can also lead to maybe more co-financed AOP programs. It is important to train the staff. So if a link worker that is hired to be a link worker is lacking some knowledge of how to tackle mental health issues, we recommend that they should be trained by health professionals beforehand. We also strongly support that facilitators should be provided also with some basic information on mental health before they start up an AOP program, primarily for them to feel more secure and confident in how to meet the participants. The training should offer space for reflection and exchange of methods and principles for the design of culture and arts facilities, and also that one can dive into one's own attributions and concerns on working with people with mental health issues, as well as how to deal with emotional situations that might occur. As I mentioned earlier on, in Fyn, we have tried out a mentorship program. And I think that we also believe that can be highly rewarding and very supportive actually for the newcomers to AOP, new facilitators to AOP, because arts facilitators understand each other's profession and logics, and having this knowledge exchange with some more experienced arts facilitators, it can lead to new and improved methods. Some of the barriers for setting up a mentor program is to making sure that facilitators know when and how to find the right mentors. Some recommendations for facilitators in this case. It is very important to, of course, plan your activities, especially the first activity. So you start up with an activity where you create some kind of group dynamic from the beginning, but also make sure that the participant from the beginning feel comfortable and build some confidence. It's good to know that artistic excellence is not the main goal of AOP programs. So the equipment must be accessible to participants with diverse abilities, and the choice of venue is also important. Good lighting, a warmth and comforting place, and not too noisy surroundings is good, so it does not distract or cause stress. It is crucial that we provide a safe space for the participants, and it can be done by creating a warm welcome, so there is a positive group atmosphere at place, to support individual pace, making sure that everyone has a voice, avoid stigma and discrimination, so AOP programs are inclusive, to plan breaks, which gives participants time to socialize, but also support those who cannot concentrate for longer periods of time, to respect passive participation, and that it is voluntary participation, so participants feels that it's okay that they take a break now and then as they need to. And then we also recommend to invite to feedback and reflection. This way, the programs are more likely to be targeted to their needs and to be improved throughout the program. So the participants feel that they also have a say in this. And for more information, please contact me if you are more curious about how we work. I also recommend you to try out our new Arts and Prescription guide, where you can find some themes around how to organize AOP, how to finance AOP, how to evaluate AOP, and how to plan your activities. Thank you very much for your time.
Thank you so much for such a rich set of advice, I think also for implementation. It's really well structured and also put together. I was wondering, I see again a lot of clapping hands. That's great. All for you. Does anybody have some questions for Stine? Some more clapping. Yes, Edith has a question.
Stine, thank you very much for this great insight. I'm not quite clear on the link workers. Are they part of your arts and prescription project, or are they part of the primary care centers?
They are both. In the different municipalities, they have found different funding models, but the project as such can fund staff costs, and that means for both the link workers and also for the arts facilitators. And some of the staff members are part of a municipal office already.
And are they from the health side or from the cultural side?
Most of them are from the health sector, the link workers, but some of them also have other backgrounds. As mentioned before, it's important, first of all, that they are empathic and can meet the participants' needs, but they don't necessarily have to have a professional health background. But if not, we recommend that they are trained so they get some basic information on mental health issues.
And their financing, would that be from the health budget or like the financing of the link worker?
We have financed our programs primarily from the funding of the culture budgets in the municipalities and from the Ministry of Culture. But some of the municipalities have continued with AOP programs after the project funded has ended, and they co-fund the programs with money from both the healthcare sector and the culture sector.
Oh, wow, this is really excellent, because that's actually what we wanted to achieve as well, of like showing how beneficial it is. And thereafter, of course, also there is a fair share from both budgets for the financing.
And I would say it's especially because we also have presented some results. We have also had researchers evaluating our program, and when they can see that it seems to improve their mental well-being, it's in my experience that then the health sector it seems more likely to take part in the financing as well.
And is arts and prescription part of a social prescribing program?
Actually, what we started, we have in Kulturregion Fyn, we have cultural agreements with the Ministry of Culture of 4 years' time. So it was part of this cultural agreement that we found the funding. Now we are hopefully starting up a new agreement that will last 4 years, and this is also a way to continue this financing of AOP programs. But it's not like in England where they have found a long-term financing on a national level.
Okay.
Yeah.
Thank you. I see Anna Formosa also has a question.
Yeah, hi again. I was wondering, do you ever find that you need more than one facilitator in a session? Maybe like a volunteer to support people who stop engaging with the session or need breaks?
Because we have the link worker present in the activities, we find that it's okay to have a facilitator who is in charge of the facilitating the activity, and then have a link worker that can support the participants throughout. But I know that in other programs, for instance, our Polish partner in the AOP program, they have more facilitators present also to learn from each other during this the activities. But it should be a balance as well, because the participants should feel that they're not being watched somehow, and usually what we find is that they feel comfortable when the link worker participates in the activities and the facilitator does the same, so they at an eye level together.
Do you have many link workers in each?
In each municipality, being responsible for a program, that each municipality has a link worker responsible for the AOP programs in the municipality. Yes.
Thank you.
Thank you very much. Again, it's great to see how advanced and also how much you achieved through also breaking some silos and managed to have some connections between the culture and the health sector as well, also on a municipal level. I'd like to go over to our next presenter, conscious of time. Her name is Tine van Goethem, and she will also be joined by Laurence Ejzyn. They are from Bozar, Brussels. Bozar is the, let's say, biggest cultural center in Belgium, or at least the bilingual one. And they are actually part of the CARE project per se, implementing arts and prescription within Bozar. So the floor is yours, Tina.
Thank you very much, and good morning, everybody. A lot already has been said, so it's nice to hear. It makes me dream also of a future on art and prescription. I'll dive with you into the art and prescription program in Bozar. So trying to do that in 8 points and 8 minutes, very sharp. We are based in Brussels, which for me is always important because we could try to copy other projects, but it's specific. So capital of Belgium in the EU, population of 1.2 million in Brussels, officially bilingual, but also significantly less wealthy in the center, as you can see, with a lot of disadvantaged neighborhoods and an unemployment rate of 20%, and more like 184 nationalities. Bozar is in the center or in the periphery, depends how you look at these kind of things, and it's a multidisciplinary art center presenting exhibition, concerts, theater, and performances. So why did we choose to be part in art and care program today is, first of all, the willing to be more accessible and to welcome more audiences, but also to meet the demand from the care and mental health sector, the network, and the expectations of the audiences. We've been talking about that. What is the right dose in a week, in a day, in a month? We've been speaking about 10 weeks, but research from Christina Davis speaks about 2 hours a week as a good starting point to start with art. We work with people with chronic and long-term conditions, people with mental health issues, and people with very diverse backgrounds. Why? It's a choice. Because we had to start somewhere, and it's a first step towards a more inclusive approach. Some of these groups are made of people undergoing medical treatment or are in remission, for example, for cancer. Others are receiving care for mental health or disability. The social prescribing is always by the medical staff and the social workers. When the institutions come on board, it's about art mediation. We offer it on an individual level, where we offer like free tickets. Free ticket is offered to the patient, and he also gets or she a free ticket, which inverses a little bit the roles and the autonomy, because here it's the patient who is inviting somebody to join to an exhibition. The second level is the group approach. We offer relax tours in the exhibitions. I'll come on back on that later. And of course, yeah, it starts with training of staff and the guides and the art mediators to raise awareness and to welcome visitors. It's a very intensive approach in dialogue with the professional caretakers and the patients to really understand the needs and to find a match. It happens before the visit, during, and after the visit. And we are still in trial and error and lots of learning. When we come to the main aspect of today, the relax tours, first of all, a group activity, always accompanied by a healthcare worker and the guide. And we take the artworks as a starting point for discussion and exchange. Relax tours require a great deal of flexibility on the part of the guide, who must constantly adapt to the group. Kindness is the keyword, and we see that multiple tours within a period of 1 year have a bigger impact. For some people, leaving their homes is already a challenge in itself. It's coming to a museum is like a first step. A relaxing visit we saw is a breath of fresh air for visitors who can forget about their daily lives of their illness for an hour and a half. It's about this personal welcoming, taking care of needs. It can be folding chairs. It can be a specific room for welcoming and ending. It depends all on the group. When we first launched this project, we thought that relaxing visits would be a little breath of fresh air in a difficult daily routine. And that's already great. But testimonials shows us that for some people, it's much more than that. It's getting out of the house, it's getting ready, it's sharing a moment with fellows. It's a start of something like we can do this. We've been working with partners. We started a project with a public health insurance company in Belgium. It's called the Christelijke Mutualiteiten. We do work with the city of Brussels, who is supporting cultural institutions and healthcare institutions and being like a link between those two with it, communication. So we do work with them, but also directly with medical facilities like hospitals and care centers. And for us, yeah, most of important are the healthcare professionals, the doctors, the social workers, and the care workers. The feedback is this, we've been talking about it on the qualitative and the quantitative level. I have no time to go in detail, but yeah, the first feedback we get is like on a psychological and social benefits, but also progression opportunities. It takes you out of isolation. You forget about your daily sorrows, and you can look at your disease from a distance. First learnings. Yeah, it's important to have this group activity and repeat activity with fellows. It's a way to demedicalize the concept of health. It does need intensive support and guidance. So it's about humans, about people who can do the job. There needs to be a sensitivity for art by healthcare workers. Otherwise, the bridging and the linking becomes much more difficult. The profile of the guides, freelance guides, which we work with in the exhibition, yeah, it allows also an approach because not everybody can do this. We need a training. And then for an art institution as Bozar, it's not enough just to work on this art mediation level, but it needs a holistic approach. How do we deal with well-being with staff? How to create an accessible protocol in the house? What do we do with artists passing by? So lots of work to be still done. What we today explained as challenges is how can we make from the relaxed tour also a regular offer and in an inclusive way, an inclusive communication, how to balance the financial resources. For the moment we can offer these visits for free. So this is also looking forward to a future new model. how to take care of the social and the cultural workers and the well-being of the people doing the job, but also the need to target new audiences to broaden our perspective, which of course will be followed by a need for tailored trained programs on that level as well. So thank you very much. It was a pleasure to be welcome here.
Thank you so much, Tine. It was really insightful to hear from a cultural institution, from, let's say, more from a museum point of view, although I know Bozar does more. And also the personal insights of what you were kind of saying, this, for some people, actually getting out of the house is already a big job. And then actually also afterwards, like, yes, I did it. And all the insights I got during that visit is also contributing maybe to a good path towards feeling better. I don't know if some people would have some questions to Tina now.
Yes, I had a question. Hello. Thank you, Tine. And question, you have artists directly involved in these programs as well, right?
Not directly. We do work with guides. They have different profiles. They can be historical arts scientists. It can be artists, but mediators, art mediators.
Because my question was about how this was also a question for the rest, how the artists are paid, or what is the pay model for the artists. So this is also for the last two speakers, a question from my side. So, okay, thank you.
Yeah.
Maybe later we can.
Yeah, okay. But yeah, they're paid and also paid for the trainings and the investment of
Okay, super.
Absolutely.
Thank you.
We have only very few profiles for the moment who can really do the job.
It's also the artist has to have an interest for this, of course, as well. And then, yeah, and there has to be some training for sure. But okay, thank you.
Thank you.
So if there are no more questions, maybe I quickly announce we would now go into breakout rooms, the purpose of which to have a small little encounter and enable for exchange.